exposition on educating our doctors and nurses on bioterrorism and infectious diseases. Could you tell me a little bit about yourself?
Well, thank you for having me. I graduated from the medical school at the University of Buffalo. I specialize in infectious diseases and biological warfare while working with the U.S. Army Medical Research Institute of Infectious Diseases. I'm interested in being an educator for medical staff and teaching them about bioterrorism and treatment process for patients if there is ever such an attack today.
Okay. All right. Well, it sounds like you're pretty qualified. Thank you so much.
Oh, wow.
You're
Thank you so
hired.
much for having me.
You're welcome.
Hello, class. My name is Martha.
Hello.
I have experience working in the U.S. Army Medical Research Institute.
Isn't that where the 2001 anthrax terrorist attacks were traced to?
Yeah, that's so weird.
That's just minor speculations. Today's lecture we will be discussing bioterrorism and anthrax. Can someone please describe the mechanism of infection by inhalation of anthrax? Denise?
Anthrax is caused by the bacteria Bacillus anthracis. There are two common ways to contract it. One is through animals. The second is bioterrorism attacks. It is the spores that make it so dangerous. The spores have to germinate in order to manifest the signs and symptoms. The bacteria then releases the toxoids that cause the damage and makes it so deadly.
Thank you, Denise. A modern concern is the use of anthrax as a biological warfare agent. And now, how could we as healthcare providers be able to circulate information about a bioterrorist attack before the consequences became grave? Susan?
Who has a suspicious case, they need to be aware of consultants that they can share their suspicious case with. Like, for example, infectious control practitioner. Also, a serious relationship between the public health authorities and private community hospitals is necessary. Once a bioterror disease is diagnosed and confirmed, it must be reported to the public health authorities and to nearby hospitals. Communication among these three parties is essential. Doctors in the area need to know when a bioterror-related disease has been diagnosed so they can be more cautious when examining their patients. Hospitals also need to inform their emergency rooms to be on lookout for relevant symptoms.
Thank you, Susan. Now, Paul, can you please describe how healthcare providers should protect themselves in the event of an anthrax attack?
Yes, I can. Healthcare providers can't help others if they can't protect themselves against anthrax. The first step of protection for healthcare providers should be the administration of anthrax vaccine. Also, the use of other preventable methods such as face masks, gloves, medical gowns, those all should be used. In the event of an anthrax attack for the general public, healthcare providers should make sure that there's more than enough anthrax vaccine to be given away. Also, this would help avoid any probable outbursts due to the lack of vaccines.
That's right.
People 18 to 65 years of age who are occupational risk for exposure to anthrax bacterial spores or anything including livestock handling or laboratory workers should know that they should not receive this vaccine. People who have not recovered from an anthrax infection should also know that they are at risk for pre-exposure. Pregnant women as well are not proven safe if taking this vaccine. And people under the age of 18 or over 65 because there are no formal studies completed in these groups. When given to prevent anthrax infection before exposure, the standard schedule consists of 6 doses administered just under the skin. The anthrax vaccine is the only aluminum-containing vaccine that is given under the skin. Anthrax vaccines may cause soreness, redness, itching, swelling, and lumps at the injection site, but about 30% of men and 60% of women report mild local reactions, usually lasting over a few days. Lumps can persist for a few weeks, but between 1% who actually receive the vaccine report moderate reactions, which is unlikely. Some people will experience rashes and headaches, but this is all natural and due to the vaccine itself.
Great job, Astrid. Does anybody else have anything to add?
Anthrax is a serious disease caused by the bacterium Bacillus anthracis. There are three major types of anthrax: cutaneous, inhalation, and gastrointestinal. Cutaneous anthrax, it occurs when Bacillus anthracis enters a cut or abrasion on the skin, which can happen when handling contaminated wood, hides, leather, or hair products. It begins as a raised, itchy bump that resembles an insect bite, but within 2 or 3 days it develops into a blister. Blister then turns into a painless ulcer with a characteristic black necrotic area in the center. Inhalation anthrax is caused by breathing in anthrax bacteria or spores. Most of the time this occurs by breathing in spores from infected animal products. It also occurs if anthrax was used as a biological weapon. Initial anthrax symptoms may resemble a common cold. After several days, the symptoms may worsen to severe breathing and shock. This anthrax is usually fatal. Last but not least, there is gastrointestinal anthrax, which occurs if it is consumed by contaminated meat. Usually, signs and symptoms include nausea, loss of appetite, bloody diarrhea, fever, stomach pain, vomiting, blood, and inflammation of the intestinal tract.
Thank you, Eric. That was very informative. Well, that's it for today, class, and I'll see you next month with another topic.
We currently have a patient who's showing common symptoms associated with inhalation anthrax. She has a fever, malaise, headache, cough, shortness of breath, and even chest pain. They even said that she might show symptoms of having shock.
Excuse me, doctors, we just got information that other patients at a nearby hospital has the same symptoms of somebody infected with anthrax.
So a plan to admit patients should be based completely on triage. Patients will be labeled as either deceased, immediate or critical, delayed or minor. Primary triage will be based on heart rate, respiration rate, and whether the airway is open and patent or compromised, and the location of any burns. Burns to the head, neck, or chest will be placed under the critical category. Children that are labeled critical will be admitted before adults labeled delayed and possibly, depending on the severity, before adults labeled critical. All others will be admitted depending on their triage tag.
Good choice, doctor.
I agree.